Hello, everyone, and thank you for joining us. I'm Dr. Kathryn Kelly, an internal medicine physician focusing on primary care, a private practice owner, and a community advocate. And we are coming together today to have an important discussion about brain health in our communities called Memory and Thought Conversations. Our goal is to normalize discussions about brain health and memory changes, encourage early conversations with healthcare professionals, and reduce stigma while promoting early recognition and support. Community organizers and leaders play a vital role in shaping how our communities approach health and wellness. We hope this dialogue will equip individuals, families, and community members so that they can engage in these conversations with confidence and advocate for impactful change. I'm pleased to be joined by Monique LeNoir, the board chair of the African American Wellness Project. Thank you so much for joining me today.
Thank you for having me.
Before we begin, I want to give you the opportunity to introduce yourself, tell us about the organization you represent and the community you serve.
Sure, of course. So I'm Monique LeNoir, as you said, and I'm the board chair of the African American Wellness Project. The African American Wellness Project was founded by my dad, Dr. Michael LeNoir. He has been a longtime doctor for over 50 years, but also he was the past president of the National Medical Association. And he's always been very, very passionate about health disparities in the Black community. So he decided to found the African American Wellness Project, and I joined at the beginning of the pandemic. And he really wanted to make a difference during the pandemic and meet people where they are with reliable and credible health information. But what we do is we provide tools and resources as well as experts to talk about health disparities and also teach African Americans how to advocate for their health and take care of their best health possible. One other thing I wanted to add is my dad is a 2-time prostate cancer survivor.
Wow.
My mom passed away from asthma when I was young.
Oh, wow.
And my grandmother also had cancer when I was young. So all of those things combined, I think, is why my family is so passionate about addressing health disparities in the Black community.
Exactly. Because it does hit us earlier and more aggressively in all of those different areas.
Yes.
So as you navigate these wonderful leadership roles, and I mean, you have other leadership roles that you haven't quite talked about in your current major projects, when you hear the term brain health, what does that mean to you personally and within the work that you're doing for your organization as you build these connections with the community?
When I think about brain health, I think about keeping your brain active and your memory strong. I think so many people think about brain health related to Alzheimer's specifically, and there's so many things that you can do and so many steps to be taken before you get to that point. So brain health to me starts when you're young and it continues. It doesn't end, it doesn't start when you reach Alzheimer's, it doesn't stop when you get a certain age. I think it's an ongoing thing where you really have to make sure that you're taking care of your best health possible so that you do have a strong brain.
Exactly. And as almost everybody here, many of us involved in the conversation have been personally impacted by Alzheimer's and dementia. Can you share your own personal experience with Alzheimer's and how that experience impacts or motivates you for your work in the brain health space?
Absolutely. So my grandmother on my dad's side, so my paternal grandmother, she actually had Alzheimer's. And she was, a very vibrant woman, lived in Harlem, New York, 4-story brownstone by herself with my uncle. She, I grew up going to plays with her and spending so much time with her in New York. And because all of her sons lived in different places, I was the one, granddaughter who would visit her quite often. And I remember one time I went to visit her and she was actually frying a piece of aluminum foil in a frying pan,
wow.
thinking that she was making eggs. And I was like, we need to do something right away because she has, she's declining rapidly. Again, just being able to spend time with her and, navigate through that with her as her granddaughter is something that I'll always remember.
Exactly. And that's a wonderful thing that you were able to do, to be a caregiver and be a support for her in those times, because that's what we need. And when we talk about community in our village as Black and brown communities, that's super important. So, and I did a little research on the African American Wellness Project, but the project's fundamental principles revolve around improving health outcomes, expanding access to quality health care for those who have historically faced these systematic barriers within the healthcare system. So how does brain health fit into the broader conversation of health prevention and quality of life in the context of health inequities?
And we partner with churches. We also do a number of webinars and community events because we really want to teach the community that this is something that if you deal with it early on, it will help definitely improve your outcomes later on.
Yeah.
So with AWP, we really have a lot of different partners that we work with in the communities, and we make sure that we're reaching out to the people that are oftentimes skeptical of the healthcare system and teach them that, hey, you can trust us and we have information and tools and resources that you can use to make a difference in the long term.
Yeah.
Because I think that building that trust takes time, and also once you have that trust, you want to keep communicating with those different populations so that you can make a difference.
Yeah. What everyday habits or early interventions do you think are most overlooked when it comes to protecting brain health specifically and especially in the Black community?
I really think, one thing that's really underestimated is exercise, and really being active and having a social circle. I've seen so many people, once they retire, they decline very, very quickly because they're not getting out every day. They're not interacting with other people. So I think, one, taking care of yourself from a health perspective. So it's really, taking care of yourself as far as health, also making sure you have a strong social circle, and then eating right. Like eating right is huge, because I think for a lot of older people, they may not have, like I said, access to grocery stores, or they may not have the energy to cook. So it's figuring out how we can support family members to make sure that they're eating healthy, taking care of themselves, exercising, and having a very robust social life so that they don't decline as quickly.
Good. But how do social determinants of health impact brain health outcomes in our community, and what solutions are promising on the horizon?
That's a great question. I mean, I know I talked a little bit about it, but just to kind of address and go back to the question of what is social determinants of health, there are everyday environmental factors like education, like economics, like healthcare access. And really, I think it's about addressing those things within the communities and building partnerships with people in the communities, like barbershops. Like barbershops are a huge place where you can really reach a large population of people where they're more calm, they trust their barber, they see that information. Churches as well. So I think at AAWP, what we try to do is we try to first of all, show that we're a trusted resource because we have an African American doctor who founded the organization. We also have a number of different doctors and all of the different health conditions that play a role in our organization, and they've been not just playing a role, but playing a role for over, like some of them, 20 years.
Exactly.
So, sharing those resources with the community and then giving them easy access to information, that's another one. Because sometimes family members are in denial. They don't want to accept it, or they're just not aware of the factors to look out for.
Yeah.
So I really think it's a matter of making sure that the whole family is involved, building a plan, making sure that you have a schedule for who's going to spend time with that family member, taking them to the doctor, because again, the things that you think may be so simple, for them is not as easy.
Yeah.
So I think that's one thing. And then the other is really just, like I said before, involving the community and trusted leaders in the community.
Exactly.
We have done, events with like the mayors of certain cities and with, council members and with clergy, because in the African American community, those are the people that are trusted. It's not the doctor around the corner who someone refers you to. It's people that you have known for years, and that's where they're going to hear the information and actually digest it.
Just like we're talking about this, we have to look at the whole person. We can't just treat their memory. We have to treat all of the parts of them.
Exactly.
Like you said, exercise, diet, their stress, and sleep. We didn't talk about, but sleep also is a big part of what we treat when we treat the whole person.
And it also can't be one size fits all. Like you said, every person is different, and so you have to give every person an individual plan.
Exactly. So another focus in addressing brain health is risk reduction, which is so important because, as we said, the changes in the brain can happen 20 years before you even start having symptoms. So what should young people be doing now to protect their brain health long term, and how can we spread the message effectively?
Oh, that's a great question. I think, taking care of themselves. The things we talked about earlier. Exercise is huge, and it's not just exercising to look good. It's exercising to feel good.
Exactly.
Eating right for your body is another one. Making sure you're taking care of your diet, staying away from a lot of sugar, soda, things like that.
Exactly.
Having like I said before, a social circle of people that you can hang out with and spend time with and use your brain, to discuss things with.
Exactly.
As well as brain activity, making sure that you're just always stimulating your brain and not
Exactly.
just resting on your laurels and thinking like I'm good, but always questioning things and utilizing your brain. I think those are all huge, huge.
So for organizations watching that may be interested in following your lead and intentionally creating spaces that normalize these conversations about brain health and early detection, how do you think local organizations can have a positive impact on brain health?
Yeah. I think local organizations probably have the greatest chance to have a positive impact because they're out in the community. They know the people in the community. Just knowing them and having those relationships with them is going to build that trust. But also, it doesn't have to seem daunting. Like when you see these screenings, like come get this health screening and people shy away from it, you can make it fun. You can incorporate it into other things that are going on in the community. And like I said previously, you can invite community leaders in who have influence in that community to really drive the message home.
Exactly.
So I think community organizations like AAWP should also partner together with other community organizations. For example, in Oakland, we have this place called Oaklandish, and everyone goes there to get their gear, and it's a very well-known place in Oakland. And we've partnered with them because that's the place that people go to in Oakland, and that's they trust that organization, they're familiar with it, and so we've gone to where the people are already going, and we're delivering the health messages and also the resources and tools where they're to meet them where they are.
Exactly. For those watching, through memory and thought conversations, I hope that you're able to walk away with a deeper understanding of brain health and be motivated to further the conversation in your family and with your primary care providers. Through these centered stories, we can shift the stigma and reconstruct the narrative around brain health in our communities while helping to build healthier and stronger futures. But it will take all of us accepting the call to action to be advocates and voices for equity in our communities. After watching this conversation, we encourage you to share it with your organization, colleagues, and community networks. Let it be a starting point for open, compassionate conversations about brain health. Thank you again for joining us.